This is Sally. She works full-time but has a young son Andrew to care for. She gets the help of her dad Steve to look over him while she's at the office. One day when Sally gets home, she notices that Steve is coughing a lot. Steve says that it's just a mild cold and that it's nothing to worry about. Sally doesn't think much of it until a few days later when Andrew starts coughing and sniffling. She believes Andrew caught the cold from her dad, so she takes time off of work to nurse him back to health. But Andrew doesn't get better. Over the next week, his coughing only gets worse. It begins to sound like a whooping noise. When his coughing gets really bad, he vomits afterwards. Sometimes Sally even thinks that his skin looks blue. Terrified, Sally calls Andrew's pediatrician, Dr. Klein. After hearing her story, Dr. Klein asked Sally if Andrew had received the DTaP and if Steve's Tdap booster is current. Sally says that Andrew has received all of his shots, but she doesn't think her dad has received a shot in 20 years. Hearing that, Dr. Klein instructs her to bring Andrew in immediately. Dr. Klein tells Sally that what Andrew may have isn't a cold, but actually pertussis. Pertussis, or whooping cough, is an incredibly infectious disease that lasts many weeks. In some severe infections, it can even last months or cause death. Pertussis is caused by a bacterial infection. It can infect people of all ages, young and old. You can catch the bacteria through droplets from an infected person's cough or sneeze. At first, pertussis looks like the common cold. You'll see symptoms like runny or stuffy nose, sneezing, coughing, or fever. But after 1 to 2 weeks, the disease gets worse. Coughing becomes violent as mucus becomes thicker and glue-like, irritating the airway. After these coughing fits, vomiting and loud whooping sounds are hallmark signs of the illness. In some severe cases, the child's skin turns blue, indicating breathing difficulties. Older kids who become ill have milder symptoms. However, in infants, pertussis can be a life-threatening condition. Though there is a vaccine that exists that provides childhood immunity against pertussis, some infants are too young to finish their scheduled pertussis vaccination series. Furthermore, 2/3 of infants with pertussis end up hospitalized. Most pertussis-related deaths are in these unvaccinated children or children who have not completed all their DTaP vaccinations. So how do our infants get sick? The answer could possibly be you. In a study that compared where infants caught pertussis, 75% of them caught pertussis from family members in the household, while only 25% caught it from somewhere outside of the home. It was found that the parents were the source of the infection in over half of the cases, but any caregiver can pose a risk to the child: aunts, uncles, siblings, and even grandparents like Sally's father. In fact, 6.1% of the time a grandparent transmits pertussis to an infant, and because grandparents are increasingly caring for children, the number will only rise. Thankfully, there is a way to protect children who cannot receive their own vaccination. Adults can receive something to protect them from catching pertussis. That protection is called Tdap. Tdap is a vaccination that protects against the same disease as the childhood vaccine DTaP, which includes pertussis. Any person working with young children, especially infants under 1 year of age, needs to make sure they have received the Tdap vaccine and booster to ensure the unprotected child does not become ill with pertussis. Vaccination is more important now than ever before. This is because since the 1980s, there has been an increase in reported cases of pertussis. Infants younger than 1 continue to have the highest reported cases of pertussis, having 100 cases per 100,000 in 2005. This is because they are too young to have completed the 5-dose vaccination series. If enough people are immune to the disease through vaccination, then the bacteria will not be able to infect those unable to get the vaccination. This is called herd immunity. The CDC has begun to recommend cocooning. By giving Tdap shots to all women post-pregnancy and all of her household members, her newborn will be protected from the infection. In the past, it was believed that the childhood vaccination series of DTaP would be enough to provide lifelong immunity from pertussis. But one series of immunizations isn't enough. Vaccine effectiveness decreases over time, so it's important to get a booster shot if you suspect that you are at risk or may be a risk to your child. And you can do your part by keeping up with your own Tdap shots. Remember, when there is a newborn in the house, Tdap for your grandpap.
Created using Powtoon.